There are three types of skin cancer: basal cell carcinoma, squamous cell carcinoma and malignant melanoma. Basal cell carcinoma is the most common skin cancer and accounts for about 75% of skin cancers. And this tends to occur in the lower epidermis skin here. They usually tend to be very slow growing and can be treated quite effectively. The second type is squamous cell carcinoma, which is sort of the upper outer layer of the epidermis, and that accounts for about 20% of cancers. Again, can be quite slow growing, again can be treated quite effectively. And the third and less common one is malignant melanoma. These tend to derive from either normal cells or cells within a mole. Again, this is quite fast growing though, and again we need to treat this very, very early so that we can get a better outcome. So basal cell carcinoma and squamous cell carcinoma tend to grow quite slowly, and they can take a variety of different forms, and they usually tend to appear on skin that's been exposed to sort of the face, the head and the neck. Malignant melanoma is more common in women, and for women it tends to appear most commonly on their legs, and for men it tends to be on their chest or on their back. So what to look out for? With basal cell carcinoma, it tends to have a waxy, sort of pearly sort of appearance to it. It can appear as a red firm lump or a flat lump, sometimes has a scaly appearance to it, and it may become itchy as well, and sometimes it can bleed. So squamous cell carcinoma tends to occur in skin that's maybe damaged because of exposure to the sun. So that may be on the face and the neck, on the back of the hands. Men who've got bald heads, for example. And they appear like they have a scaly type of appearance, and they may develop a horny cap to them, and it can be very tender to the touch. For malignant melanoma, sometimes it's quite difficult to tell the difference between a mole and a malignant melanoma forming. So there's an easy checklist to remind us of what to look out for. So it's A, B, C, D, E. So for A, we're looking at asymmetry. Usually moles tend to be the same on both sides. With a melanoma, sometimes that asymmetry is lost and one side grows faster than the other. B stands for border. Again, with a normal mole, the border tends to be very well defined and very uniformed. With malignant melanoma, this might not be the case. It might be all raggedy and very undefined borders to the mole. C stands for colour. With a normal mole, usually the colour is all the same all through the mole. It tends to be sort of brownish colour. Within a malignant melanoma, there might be patches of brown, pinks, reds, so it's not the same all the way through. D stands for diameter, so look at the width of and the size of your mole. Moles tend to be about 6 millimetres or less. And E stands for evolving or changing. So what you're looking for there is any changes within that mole. So has the colour changed? Has the symmetry of the border changed? Has it become itchy? Has it become raised, crusty or bleeding? So if you've got any of those A, B, C, D, E signs that you might be concerned about, you need to go and seek help.